This is Dr. Thomas Lamperti. I'm a double board certified facial plastic surgeon in Seattle. Today I'd like to show you some video clips from before and after a septoplasty surgery. Here we're using a speculum to look inside the left nostril, and you can see where I've marked the marking pen the planned incision line for the surgery. That allows us to enter and lift the skin lining off of the septum, which is on our left. And you can see very well in this patient how her septum is quite deviated. We'll enter in a second with our camera, and you'll be able to see even further back and see where it worsens as we proceed further in the nose. After the initial deviation inferiorly, you can see how posteriorly there's a large spur that in fact contacts the patient's inferior turbinate. We'll try to advance so you can see that a little better. Telling finding is that it's quite difficult for me to advance the telescope to see, as it's quite narrow, and more so than normal certainly. This patient's septal deviation is also significant for the fact that it occurs along the entire length of her septum. This creates even more resistance than if it were just a smaller area that was equally deviated. So how much improvement can we make with septoplasty surgery? I'll show you a video clip of this patient right after I completed the surgery. You can see the incision line on the left. Those are the dissolvable sutures that'll come out on their own. And we'll advance further back. You can see the improvement already, although there is swelling and obviously some oozing of blood, which is normal right after surgery. You can see the very posterior part or back part of her nose, and in fact you can see into her nasopharynx. This is an area that had been completely obstructed, and as you recall, at the beginning of the surgery we weren't able to advance the camera past that area to see it at all. So you can imagine how much improvement to airflow and congestion will be seen after she heals.